Mr. President, I'm pleased to join my colleagues on the floor today in support of legislation that would address what's happening in our long-term care facilities across this country as the result of the coronavirus. I want to applaud Senator Casey for his leadership on this legislation and say how pleased I am to be able to join in co-sponsoring the bill, along with my colleague from New Hampshire, Senator Hassan, Senator Whitehouse, who was here, Senator Blumenthal. We're all here because this country is not doing enough to support long-term care facilities and nursing homes in America. But before I talk more about that legislation, I just have to begin by expressing my outrage at the fact that this administration has directed the Department of Justice to weigh in to try and overturn the Affordable Care Act at a time when we have millions of Americans who are vulnerable during the coronavirus pandemic. And as of today, 2.5 million Americans, nearly 6,000 patients in New Hampshire have been infected with the coronavirus. Nationally, more than 125,000 Americans have died. In New Hampshire, nearly 400 Granite Staters have died from complications from the virus. And yet, what this administration is doing is trying to strike down the Affordable Care Act and to take away health care coverage from 23 million Americans, including over 90,000 residents of New Hampshire. That means, if they are successful, that we will have millions of Americans with pre-existing conditions who will lose protections that they rely on. We'll return to the days when insurers can deny coverage to people with pre-existing conditions or charge them higher premiums based on their health status. Insurers will once again be able to put caps on the dollar value of health services that can be covered in a year or a lifetime. And at a time when unemployment has risen to levels that we have not seen since the Great Depression, this administration is asking the court to strike down the Affordable Care Act's Medicaid expansion provisions, which in New Hampshire has been the most significant factor in ensuring that people who are struggling with substance use disorders are able to get treatment. This Senate should not stand silently by while the administration tries to tear down the Affordable Care Act at a time when people are most in need of assurances that they can get health care coverage. We need to come together to address what needs to change about the Affordable Care Act to make it better. But we need to do that together. Because if this administration is successful in striking down the Affordable Care Act, they don't have a plan of what's going to replace it. But during this global pandemic, it's not enough just to protect the Affordable Care Act from ongoing sabotage. We've also got to do more to support frontline health care providers, especially in nursing homes and long-term care facilities that are caring for vulnerable seniors. And that's what this legislation that we're speaking to is all about. In the Granite State, we know just how dire the needs of nursing facilities have become, as nursing home residents account for approximately 80% of the coronavirus deaths in New Hampshire. I want to just re-emphasize what Senator Hassan said. 80% of the coronavirus deaths in New Hampshire. We have the highest rate in the nation of deaths in long-term care facilities. And yet, we have nursing facility staff in the state who tell me they are stretched thin due to increased cost from the coronavirus response. They have reduced revenue because they've had to postpone stays in long-term care facilities for patients who need physical rehabilitation. It's critical that the Senate take action to provide more support to these facilities so that they can afford the additional staffing, the testing supplies, the personal protective equipment that will be needed to keep our seniors safe. That's why I strongly support Senator Casey's bill that would provide $20 billion in new aid to nursing facilities to help them confront this pandemic head-on. This bill needs to be a central component of any future round of coronavirus response legislation here in the Senate. Our communities are demanding action to respond to the ongoing impact that the virus is having on the public health and on our economy. And as I said last week on the Senate floor, it is long past time for this body to join together and get serious about another coronavirus response bill. You know, the really impressive thing about what we've done to date in response to this pandemic is the fact that we have worked together to get 4 really significant packages of legislation done. And yet now it's been 6 weeks since the House passed its coronavirus response package, known as the HEROES Act. During that time, there has been no action here in the Senate to take up a Senate response to the coronavirus. That needs to end. I mean, even today, we heard the governor of New Hampshire, the Republican governor, Chris Sununu, announce that in New Hampshire, our state expects to experience a budget shortfall of nearly $540 million. That's about a 20% drop in state revenues. That's going to have a huge impact in New Hampshire, not just on health care, but on so many investments that the state needs to make in our schools, in responses for first responders, in roads and water systems and critical infrastructure. And everyone in the state, from town administrators to the Republican governor, all are describing the tough choices that they're going to have to make if federal assistance doesn't arrive soon. And of course, that extends to our nursing home facilities, to the many businesses and organizations in New Hampshire and across this country who need more help. So I urge our colleagues to support Senator Casey's legislation. Let's get assistance to those facilities that are so much in need and come together and demand that we get another coronavirus response package of legislation so that people know help is once again on the way. Thank you, Mr. President. I yield the floor.